Welcome to episode 44 of the LorainCounty.com Insights Podcast. I'm your host, Ed Skimmon. Before we dive in, I'd like to thank the LorainCounty.com champion sponsors who make this podcast and so many community initiatives possible. Lorain County Community College, Community Foundation of Lorain County, WOBL Radio, Emerge Inc., and Lorain County JVS. Today we're talking with Dr. Rebecca Starck, president of Cleveland Clinic Avon Hospital. Join us as Dr. Starck talks about Avon Hospital's history, its wide range of medical services, and its work to provide seamless patient care. She shares how the hospital addresses social determinants of health, improves access to care in Lorain County, and collaborates with the community and many community organizations. Dr. Starck also shares her professional journey, the role of AI in healthcare, and her personal interests. I've known of Dr. Starck for many years, but first got to know her a few years ago when Cleveland Clinic and LorainCounty.com were both business champions for the Community Foundation of Lorain County's annual Connect to a Cause. Dr. Starck leads a team of around 1,000 healthcare providers who directly impact the lives of tens of thousands of residents in Lorain County. Here is my conversation with Dr. Rebecca Starck.
My name is Dr. Rebecca Starck. I am the Vice President and Chief Medical Officer at Cleveland Clinic Avon Hospital, and I'm an OB/GYN provider.
Welcome, Dr. Starck. Thank you for joining us and sharing your insights. Could you provide an overview of the Avon Hospital and your role with the Cleveland Clinic?
Avon Hospital opened in November of 2016, and we were the first Cleveland Clinic hospital in Lorain County. Really, the idea was to bridge the gap in the care for our patients, having several Cleveland Clinic providers practicing out here for many years, both at Chestnut Commons and Lorain, as well as here at the Avon Richard E. Jacobs Health Center. We had many other providers at, their own physicians' offices, but when they had patients who needed to be hospitalized, they needed to go to either non-Cleveland Clinic hospitals or Cleveland Clinic hospitals much further away in Cuyahoga County. So the idea was we were here to really bridge that gap, to be able to serve our patients where we had that seamless transitions of care with a unified electronic medical record and have that platform where we could really meet that inpatient needs. And also, from time to time, we have to transfer patients to a higher level of care, either at Fairview Hospital or the main campus. And really, because we are a system, it feels very much from a patient standpoint that communication is very solid and they're just going down the hallway when in fact it might be to another facility.
Could you talk about the medical services that you specialize in here?
So here at this hospital, it's probably easier to say what we don't do. We don't have inpatient psychiatric beds by code or designation. However, we take care of many patients who have psychiatric conditions for their medical care, but it's not an inpatient psych hospital per se. We don't do obstetrics. We don't do pediatrics. We don't do open heart surgery. We do, however, a variety of just general medical care, surgical care, orthopedics, urology, vascular surgery, GYN surgery, plastic surgery. So we do provide a comprehensive platform of services. In addition, we have a 12-bed intensive care unit, as well as our emergency department. Our emergency department does serve pretty much all comers, including those pediatric patients. If they need inpatient care, they would be transferred to either Fairview Hospital or the main campus.
Could you talk a little bit about the value that Avon Hospital provides that benefits the wider community?
I often say the care we deliver is not just about the patients who come into our hospital and onto our campus. It's really, truly that community support and the community outreach. So I think that's been probably the most rewarding. One of the most rewarding parts of the job is really to be able to interact with the community at large. In my role previously, I was the leader in women's health, and as an OB/GYN provider had been practicing out here in Lorain since 2004 and was very much involved on a larger scale around addressing infant mortality and focused more in the Cuyahoga County area because most of our practitioners were in Cuyahoga County. But pivoting into the role when we were opening the hospital, recognizing that to really build relationships in the community, it was about that collaboration in the community, building trust. So I found early on a great deal of benefit and reward in connecting with other community stakeholders, both at EMH, Mercy, Lorain County Health and Dentistry, County Health Department. So working with our other community leaders and addressing our health and our community's health has been very rewarding and very important. I think that collaboration, working with Commissioner Mark Adams now on our Lorain County Health Improvement Steering Committee, along with those other entities, Lorain County Alcohol Drug Addiction Services that has now transitioned to Rivian. We really meet regularly as we address our community health needs on how we can work together, because none of us can affect the kind of change that we need to improve community health. So we talk regularly about what are the social drivers? What are the things that will most impact health? 80% of a person's health outcome is largely attributed to those social drivers. Do they have healthy food? Do they have transportation? Do they have access to care? Do they have financial ability to pay for their bills or food, what have you? So we work together. It takes coordination and collaboration. Public transportation is essentially non-existent in our county. And we recently had our Community Advisory Council meeting for Avon Hospital, and we asked our local stakeholders, what's the key social driver? And of all of the items that were, listed, those that I mentioned, transportation rose as the highest that our community stakeholders really felt was likely the biggest impact as a barrier to health. So getting involved with that, I think, is very important and has been very rewarding. We screen all of our patients for social determinants of health, their needs. We actually have a food pantry here at Avon Hospital. So if somebody comes in for an outpatient appointment next door at Richard E. Jacobs, or even for an x-ray, imaging, lab services, they come into our emergency department, or if they're admitted to the hospital, we screen for any social needs. We can get them access to an emergency food supply for 3 days, and we connect them through Second Harvest. So then they have those wraparound services that are needed.
Very good.
We can help offset if they have determined to have need for medication costs or transportation costs. We use some of our president's funds to help support in that regard as well. We recognize it's not just the healthcare we deliver in our building, it's how we work together with the community to improve their wellness.
You may have answered my next question, which is, what do you see as the biggest health-related challenge in Lorain County?
I think it's the access to care, and it starts with transportation. I think that, in fact, is a big one. Clearly, we have the chronic disease circumstances that is decades long of smoking, lack of exercise. I think post-pandemic mental health is a huge need for us, and that's definitely emerged in our community health needs assessment and the county's health assessment. So those clearly are topics that we need to address. Infant mortality and kindergarten readiness is another one that we've focused on. But the transportation piece is unique and is something that we recognize. Now, we offer virtual services for healthcare, but not everyone has the ability to access it through virtual services. So trying to get care closer to our patients, but also making sure they're mobile and can get where they need to.
What's something people don't normally know about Avon Hospital and the way it operates that you'd like them to know?
I would hope people do know this. We have our caregiver town halls going on this week and our engagement survey. I hope people feel and recognize that when they come to Avon Hospital, our goal and everyone's goal here is to provide the highest quality care, the safest care possible. We want everyone to feel safe when they come here, whatever their circumstances. It's something we talk about every day, and what can everyone on the team do to drive that quality and safety around the healthcare that's delivered. I think that's number one, but equally important is making sure that our caregivers, everyone who works here, recognizes that it's a great place to work. We have a fantastic team. People want to work here. People choose to work here. We work with the Lorain Community College. Maybe this is one that people don't know, is we invite students from every single high school in Lorain County to come and shadow or have a tour and experience healthcare at Avon Hospital. Anything from lab to imaging to the emergency department to surgical services. They take a tour. They get introduced to the vast number of careers that are available in healthcare. Respiratory therapy. That's been really exciting. We do that with the Educational Services Center under David Miller. And it's a great way to introduce and work on our pipeline to recruit healthcare workers. And I think working with the college, working with the local high schools and JBS, it's that economic engine healthcare can also provide, in addition to providing great healthcare, but really truly keeping jobs local and helping individuals realize that if you enter into a job at the Cleveland Clinic, you can be here for life. I mentioned to the team when we have our town halls that I started my career as a phlebotomist. When I was an undergrad, I learned how to draw blood, and I was drawing blood, and it was a great skill to have when I was in medical school. And when I rotated through the VA, they would always come to me and say, "Can you go get Mr. Smith's blood? We're having a hard time." And so, but to be able to then go into medical school and become a surgeon, GYN, gynecologist, OB-GYN. But then who would thought I'd be able to oversee opening of the hospital? It's really profound, but to have that exposure, that experience. And we see caregivers pivot across our hospital from patient transport to patient care and nursing assistant and then on to nursing school. So there's lots of opportunities, and having that available to our community is very important and very impactful.
About how many employees here?
In the hospital, we have roughly 1,000 that are some designated just at Avon and some are matrixed. And in Lorain County, the last I got information was roughly 2,100 who are employed in the county. So it's a profound number.
How do you measure success at Avon Hospital? What metrics and outcomes are most important to you and the team?
We are all about metrics and measuring success. There's dozens of raters and rankers, right? Newsweek, U.S. News and World Report, CMS, Health Grades. Everybody's measuring us. Everybody's rating us and ranking us. Some of it's reputational. Most of it is data-driven. And the Cleveland Clinic uses Vizient, which is a composite index measurement of quality and safety, efficiency and effectiveness of care, mortality, patient experience, health disparities. There's about 90 different metrics that are measured, and we're measured against many hospitals across the country, and we're measured in different cohorts. So some are large academic centers like our main campus, some are tertiary care centers like Fairview Hospital, and then some are small community hospitals like Avon. And we're compared to roughly 300 other hospitals. And our goal is to be at the 90th percentile. So at the top 10% in our performance. And we're pretty close. We're at 88% right now. And we're always driving for perfection. I think our patients deserve that. I think that's something that we want innately our caregivers to desire that as well.
What trends do you see in healthcare, and how is Avon Hospital adapting to these changes?
We always say plan for change. Change will be part of our existence always. I think that the biggest impact right now is technology. Now, clearly, there's a lot of other rhetoric around policy and politics and tariffs and cost. And we all know the cost of healthcare is going up. Reimbursements are not, which means it's harder and harder to have a margin to be able to invest more into what we do. But no question in my mind that technology and artificial intelligence is going to be the biggest, I think, pivotal change in what we do. When we opened this hospital, we were stated to be the hospital of the future. And we were going to use technology to really enable the work that we do. And I think we did a great job of doing that. There were some things that about 6 months in, we had to just realize that this really wasn't supporting what we were doing. We had installed in our ceiling infrared tracking mechanism to see if people washed their hands before they entered the room and left the room. So we were going to be able to, in real time, track hand hygiene performance. It's a big thing in healthcare. It didn't work. It didn't connect as it was supposed to with foam hand sanitizers. So a silly thing. After months of trying to track it and using badge readers, and I finally said, we're spending too much time and manpower and trying to make this work. Let's forget about it. Let's just make sure everyone uses hand hygiene. We also had something called an interactive patient TV. The idea was it would be connected with the electronic health record. And when a patient's in the bed, we could utilize the TV to provide patient education videos, a smart TV on steroids for healthcare. Some of it worked and some of it didn't work. So that's an example. But I think the way AI is changing healthcare is going to be extremely important. And we've already seen some examples at the clinic where it's had huge impact on patient care. One is we're using something called Bayesian, which is a technology, an AI sort of tool that helps to risk stratify patients for sepsis. And it's been rolled out in some pilot hospitals. We're rolling it out here at Avon actually this week. So it will be able to alert our providers when the physiology of a patient is indicating that they could become or they are at risk for sepsis or starting to show the early signs of sepsis. Heart attack is an emergency. And so treating and addressing it very quickly can save lives. So that will basically alert our providers that a patient is starting to deteriorate. Sepsis is thought to be the diagnosis. And so that's changing patient care. We also have in our offices, in our outpatient offices, something called Ambience, which is an artificial intelligence tool. When I see a patient, I get their permission to use AI, and I basically will click on my record button, set my phone down while I'm having a conversation with my patient. And I was a skeptic. I was a little bit of a skeptic, but I tried it with a few patients, and I've talked to other providers who absolutely love it. And it is truly a game changer. So I have my entire conversation with my patient and I type nothing in the computer. Usually I'm sitting at the computer typing, and I pretty fast. I was
Sure.
proud of my typing skills in high school. I was 63 words a minute. So I thought, well, I can type pretty fast. But this allows me to not look at the computer, but to spend my time talking to the patient. And I was thinking, there's a lot of, you can tell I like to talk. There's a lot of time I'm talking that's maybe not relevant to their healthcare, but it's us catching up on our lives, our kids, transition. And we might be talking about perimenopausal symptoms. We might then pivot to urinary incontinence. We might go back to perimenopause, menopause. At the end of this, I'm thinking this is going to be a disaster, right? Somehow this ambience tool organizes my discussion, puts it in a neat, nice package. It will interface with the patient's records. I review it for accuracy. It's amazing. And I will still do my exam, and I will still document my exam separately. Some can actually speak to the microphone and it will document the exam for them. But one of the providers said to me, the best thing is it gives him more mental capacity at the end of his day, which I thought was a really interesting way to quantify, because it is hard to quantify how much time you're saving. But he's like, it's just so much less exhausting because I just spend my day thinking and talking. I don't have to do all that tedious typing. So I thought that was a game changer.
How long until it'll prompt for maybe ask this or maybe look into this or?
I think already that's there.
Okay.
At the end of the visit, it's helping me, again, it's helping me organize my note, organize the diagnoses that I talked about. And it can even help with giving sort of patient instructions, educational tools
Sure.
at the end.
Its ability to have access to the full patient history in real time immediately could be really powerful.
Incredibly powerful.
Let's switch over and talk a little bit about you. What's your background and what led you to your leadership position with the Cleveland Clinic?
I'm an OBGYN provider. I'm from a small town in West Michigan. My father was a builder. My mother was a nurse. And I would say both were leaders in their respective areas. My mother went all around the country on medical mission trips, and she opened up a home health care agency, and she did work with caring for patients during death and dying, wrote a course on I Can Cope for patients with death and dying. She ran the Red Cross for many years. My father oversaw building large buildings, including our local community college and a hospital. So I always think that's interesting when it came back to Avon Hospital. But prior to getting into my leadership over Avon, I was first and foremost a clinician, and I loved my practice of OB-GYN, preventative health. And I still have patients who I've been seeing for 25 years. I was in the office yesterday seeing patients. And one of my patients said to me, she just moved over to Hudson over on the east side. And she's, you know, that I've been coming to you for 25 years. I'm like, oh my goodness. She's like, that's over half my lifetime. I'm like, wow. I truly feel like my patients are my friends. And some days I feel like they should send me bills instead of me sending them the bill.
I'm sure they will.
I think I learn as much from them as maybe I provide for them. But I took a role as the chair of our regional OBGYN department in 2010 for the Cleveland Clinic. And I loved that because it gave me the ability to help drive quality improvement and improve provider efficiency and operational efficiency. And I felt like I was able to help. My mantra was I wanted to personalize it for the providers so that they felt that they were in a rewarding job and help them through their career. But it was ultimately indirectly helping provide better care for patients in some circumstances. So that was a great position. I had a great run for about 7 years, and our department was all the way from Fairview to Hillcrest, and we were just taking on Akron at the time, and we were expanding with midwifery services. And by the time I was done, it was maybe like 120 or 140 providers in that range, but it was very exciting. And then that's when I mentioned I'd gotten involved in infant mortality and our work in first year Cleveland trying to address infant mortality. And during that time frame, my practices out here in Avon had the opportunity to get involved in the Avon project. And I thought, hospital? What do I know about running a hospital? Super exciting. That's when my father sat on one shoulder and said, you can build a hospital. You can help with that. My mom sat on the other shoulder and took that leap of faith, learned an incredible amount about many different specialties in healthcare, cardiology, neurology. I got exposure to all these different specialties to help drive our service line planning. But then working with the trades was super exciting and fun. I got to know general contractors very well and the electricians. And we had monthly meetings as we were opening this hospital. I was here from 2 years prior to it opening. And as I mentioned, not only service line planning for what we needed to provide when the hospital opened, but then working on that community outreach aspect and building trust in the community. And it's been, again, very rewarding.
In the time you've been with Cleveland Clinic, what are you most proud of accomplishing?
I'd say the hospital. I think overseeing this has been incredible.
So I'll go back to the fact that you still see patients, which I think is fantastic and very valuable. What have you learned from patients that influences the decisions you make as a hospital leader?
To never forget just that, the personal direct interaction with people. It's critical, right? And sometimes, I'll be honest, sometimes running the hospital, I feel like, am I really making an impact? Yeah. Or you get frustrated with bureaucracy or politics or matrix organization or this or that. And then I go to my office and I come home and I feel so good about my day because I spent a half a day seeing patients and I feel like it fills my cup, right? It makes me feel like, okay, that's why I'm here. That's why I'm in healthcare. And being able to bring that back into the leadership role of the hospital is truly about that one-on-one interaction. It might be brief, but it could be walking down the hall and greeting our caregivers or going to the town halls and reminding everyone, why are we here? And every single patient matters. Consider every patient in the bed like your family member. Do the best that you can to make sure that patient has the best care possible, but also recognize that not one of us can do our job alone. Everyone needs to have a team and everyone on the team is important. So the people cleaning the rooms are just as important as the people delivering the trays or as the people passing the medications, as the people ordering the medications. Because if somebody fails, something bad could happen to that patient. So we all have to celebrate and acknowledge and reward and value everyone else on the team.
Going forward, what are your personal goals? What would you still like to accomplish professionally?
I would love to see us grow more here at Avon. I believe that we have an opportunity to serve more patients. I think people in this community really want Cleveland Clinic healthcare, but I think even beyond that, this is a great location. People will drive to get here because, again, our reputation has been outstanding. I could envision expansion allowing us to serve from a much broader standpoint, bringing higher acuity services closer to people, but also I could see us drawing from patients beyond even Toledo. It's just easy to get here. And because healthcare has changed so much, I think large systems like ours are going to have to step in and support broader, larger geographic reach.
Do you have the space here to expand?
We have space, we have land.
Okay.
Money is a little bit of a challenge. Parking would have to be factored in. Things are costly, many competing priorities. I think more than ever, we're going to be looking to get support from philanthropic sources because, again, as I mentioned, the margins that we see are getting thinner and thinner every year, but it's our obligation to serve as many people as we can.
Outside of work, what are your hobbies and interests and how do they help recharge you?
I have 5 kids. As I say, I still have 5 on the payroll. Would be nice to get a couple of them off, but they are growing and getting older and in college, so there's hope. We love to spend time together. We all love to ski when they're home. We downhill ski in the winter, and in the summer, we're sailors. We're avid sailors and into sailboat racing, so they're all competitive in sailboat racing.
Yeah. Finally, where can people go to get more information on Avon Hospital and connect with you?
clevelandclinic.org, and there's links to Avon and then my profile as well. And don't forget, it's STARCK.
Thank you very much. I appreciate it.
Appreciate it.
Thank you for listening to the LorainCounty.com Insights Podcast. Each episode, we share conversations with the people shaping life in Lorain County, from business and government to education, nonprofits, healthcare, and entertainment. Be sure to follow or subscribe on your favorite podcast platform so you never miss an episode. You can also visit LorainCounty.com to discover local events, volunteer opportunities, and more community resources. If you know someone who's making a difference in Lorain County, send us a note at podcast@LorainCounty.com. We would love to share their story and insights. Special thanks to our producer, Leah Gerke, and to you for listening. This has been the LorainCounty.com Insights Podcast, conversations with the people shaping Lorain County.